The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
Good evening. Welcome to yet another episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle. I am Jessila Mujib. This is a talk show exclusively with the expert doctors of Al Hilal hospitals and medical centers. Antibiotics, as you are aware, are used in the treatment of many infections and are known to save countless lives. But improper and overusage of antibiotics may lead to a serious condition called antibiotic resistance. To discuss this topic in detail, we have with us Dr. Khalid Khalil Afifi from Al Hilal Hospital, Sitra, from the Department of Family Medicine. So, to discuss this topic, let's move on to the doctor. So, doctor, welcome to the show and thank you for being with us today.
Thank you, Jessila. It's good to be here.
It's
Thank you
a
for
pleasure.
having me. Thank you for having me.
Doctor. So, doctor, let's begin by discussing what are antibiotics.
So, if we take it to the definition, we break down the word.
Okay.
Antibiotics, anti means against. Bio means alive. Tic is just a part that we like to add to the end of things in scientific terms. So, anti-alive, against something that is living. Antibiotics is a class of a bigger things that we have against living things, which is antimicrobes. So antimicrobes has multiple different things: antifungals, antibiotic, antiviral, anti-helminth, which is worms and so on. So antibiotics in our context is the one against bacteria,
Okay.
which we can call antibacterial specifically, But for the sake of the conversation, colloquially, we just go for antibiotics.
Can you describe the sources of antibiotics now?
So, well, if we go look at the source, we'll find antibiotics everywhere. In the sense of there is natural presence to antibiotics, and natural things have antibiotic properties.
Okay.
So, for example, if you put honey on some fruits, and it's been noticed that honey has antibiotic properties, what we mean is that if you put, for example, honey on fruit, it will not rot as fast. They will not be showing the signs of the growths on it after as many days as if it wasn't there. So from old ancient times in traditional medicine and before we had manufacturing antibiotics, there was natural things that have antibiotic properties. Now we have discovered them from some sources in nature, and we might have modified them. So the new age of antibiotics was in 1928 when a gentleman called Fleming had a culture of a bacteria. I think it was a staphylococcus. And some mold grew next to it. And it grew over the territory of the bacteria. It overtook it. It reigned over it. And he noticed something and he said, oh, how did this happen? And later it made him think, this fungus must have had something that used as a weapon against it. And the name of this fungus is Penicillium. And that's where we get now penicillin. He did his work and he got penicillin from that fungus, and that's the first new age discovery of antibiotics in 1928. And from then on, the world also, I would say, has been different. We could not all imagine a world that didn't have this revolution in discovery of antibiotics.
So that's how antibiotics were
The
discovered.
new age.
Yeah.
And that was, as I said, how we know it as it is more now. Since then, it's been discovered and discovered and discovered and rediscovered. We've just been discovering a lot.
Okay.
Yes.
Now, let's go to the side effects of antibiotics.
So antibiotics will have, like anything else in life, side effects. Everything has a certain range of side effects. Even food has side effects. And just like any other side effects, we will have it divided by severity, mild, moderate, severe, life-threatening. Yeah. Between these four, and how likely they are to occur.
Okay.
So, alhamdulillah, that the worst possible thing in general, as a rule of thumb, is the 1% or less than 1% rule. That's anaphylaxis. That's a possible side effect with almost anything. You can eat something and get an anaphylaxis. You can touch something and get an anaphylaxis. Anaphylaxis means a severe reaction to something that your body just goes haywire.
Okay.
Everything just tries to shut down. Your throat thinks that you're gonna inhale something really bad, so it just closes on you. It's almost as if, right? That's the worst one, but it's less than 1%. Then you have the general milder ones, which is up to 10% that someone can feel, which is usually as you're taking any oral tablet, you might have the gastric discomfort. Okay. Many medications are related to generally gastric discomfort and to different levels of people. Some people are just generally already sensitive. And that's a range between 1 to 10%. Then you may have skin reactions. That's another way that generally allergies may present. And even skin reactions have different range. So it can be just a little bit of an itch, a little redness. Can be more widespread, or it can be just full body also. And then this is what we would go and call severe. There's a severe reaction. And we factor that in also, our previous knowledge of the patient, as well as possible foreseeable side effects we have to mention to the patient or anyone who's taken antibiotics. Yeah.
So in what all conditions you prescribe antibiotics? Our viewers would like to know.
So we give antibiotics when we are strongly suspecting or confirmed that you have a bacterial infection.
Okay.
So we can give it based on a clinical examination. for example. We can do it that in the clinic I've seen the ear, and for example, take the scenario of a child. Came in with a sore throat, yeah, a 5-year-old. Came in with a sore throat, a fever, mother brought him in, and tugging on his ear, oh, he's got some ear pain. I look in there, and it can depend on me if I will say it's a viral, and I will not give an antibiotic, or I will see signs of it being bacterial and I will give it. While I'm looking at the throat too, there's certain things. When we're looking during the physical examination, it's like a tool for us. We're collecting data, as valuable as a lab test.
Okay.
And it takes a few seconds.
So you mean by physical examination you can make out it's a bacterial or viral
Yes,
infection?
that's the first step. Before they're out of the door from the clinic, I either know or have a suspicion.
Okay.
So they're either going to collect the medicine or that they're going to confirm it. Yeah. This would be based, that's one of the things that I would see, for example, from the clinical examination. The other one would be, if I'm having a suspicion or a doubt, is that I would have an arsenal of tests and things that I can do in order to find out, is there actually a bacterial infection? And furthermore, if there is a bacterial infection, what specifically is it?
Okay. The culture.
The culture, that's the culture, yes, exactly. Now, to do that, we can do it, for example, with a blood test, the full CBC, full blood count. In that, we see some of the values from the blood sample that we've taken. One of them is the white blood cells. That's our body's innate immunity that ramps up when we're fighting an infection. So the white blood cells will be higher, different ratios of them. We look into all that, and then we can discern viral, bacterial maybe, or even inflammatory. We can do the culture then at that point, if there's any doubt as to what may be causing it. If it's special cases, we will always like to do a culture in certain scenarios. And now we can culture almost everything. We can culture nose, ear, mouth, any kind of abscess. We can take anything that as a presentation, as a focal point of the infection, and we can almost culture now everything. That culture report also gives us something called sensitivity report. What is this bacteria sensitive or resistant to? So it's very handy tool. It's a very handy tool to have, and it's more so now being used. Out of need and out of also availability. Thankfully, that we have advanced well enough in order to have this resource available readily.
Okay.
Yes.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
So doctor, our topic is antibiotic resistance. So I would like you to describe more about antibiotic resistance.
Okay. So, like anything else that's living, there's a natural process to its existence. In the sense of, we as human beings, for example, we have an immunity that can happen actively, like your body had to fight for it. Like you got an infection and now your body's learned the lesson and it has an immunity against that microbe, be it viral, bacterial, whatever, for example. The same thing is for the bacteria itself, that they can split and grow in number, and they have generations also. They have many different generations. So say a bacteria had an encounter with an antibiotic compound, and it survived it. Now, why it could survive it is, for example, it didn't get a high enough dose. It wasn't encountering it for long enough. It was the wrong antibiotic that had some function, but not 100%, you know? Then as it splits and grows, that specific bacteria will spread more with that knowledge. And it will over time become immune itself to the antibiotic that we are giving. So it will learn, essentially. Smart by design. That's the bacteria. So as that happens, we get resistance from those bacteria to whatever antibiotic it's becoming resistant to. Usually it's taking place as an antibiotic is being given more frequently, and as it's being not taken for long enough. For example, if you said a course for 7 days, you felt better after 3 days, you stopped it, and then that bacteria that survived, instead of being killed off by the 7th day, it survived after the 3rd day and it was discontinued, and that bacteria went on to become more resistant. These things are what we know about the resistance and how it develops. So their innate immunity, the bacteria, allows them or forces us to go for another antibiotic, for example. And thankfully, we've advanced enough that we have now many different lines of options. So for antibiotics, there's maybe 7 classes, specifically big ones, and we have different ranges for them. Some of them are wide range, so they work on a lot of bacteria at the same time, and some are more narrow range and specifically work on specific types of bacteria. Resistance can happen from this repeated exposure, and it can happen to more than one type of antibiotic. Okay. So we have from this family now, we cannot give from this family, this type of antibiotic will not be useful. And that's when we get the culture and sensitivity reports. It will tell us which is resistant and which is sensitive. And we can tell if we would be using the right antibiotic or not.
So how do you know a patient is resistant to antibiotic? Any specific symptoms present?
It's not particularly a symptom that will present, it's more of a failure of treatment that will present. So someone is taking an antibiotic correctly, diagnosed as a bacterial infection, for a specific bacterial infection, given an appropriate antibiotic, but they're not getting better over 3 to 5 days, or they're only getting worse. Okay. Then in that case, we can suspect, right? We can take a swab, we can take a sample to deduce which bacteria it may be. But then, in the meantime, we can go for what's called first-line or empiric therapy. And then second-line therapy we can give, and then send off to the lab a sample and figure out exactly by the name and the number what's going on. But generally, we start with first-line antibiotics, which is empirical therapy. This is the case, that's the presentation, unless otherwise that you cannot give this antibiotic like an allergy to it or a previous side effect. Okay, a specific one that we like. Okay, we won't go through there. The patient said, "Oh, full body rash happened after 2 days after I took that antibiotic. We will not give it again. We will not risk a full body rash again." So we have the guideline to work with that we can tell either by lab which antibiotic to give, or by if this is failing, what to go for next.
Okay. So how will you deal with such a condition?
Simply all you can do is prescribe the correct antibiotic.
Another one?
Another one.
Okay.
It can go up to 3-4 different tries. Depends on how resistant it is. But thankfully the culture and sensitivity allows us to be more thorough with that. We don't have to try more than 2-3 times.
Okay.
Now, because if you have that available, you can check. Now, what can happen is that this report can come back to you and it can tell you resistant to everything you have. And then that's a scary report that I've never had it actually happen to me in my professional career.
You never encountered such conditions?
But it's in the studies. There's reports that are documented. And it's something that, a phenomena that's actually having its own term coined.
Okay.
It's the superbug.
Oh, okay.
Superbug. So this superbug is resistant to most readily available antibiotics. That must be an old generational bug that's really had its time.
Okay.
You know how many generations it is to develop, and it takes time. And this is an issue that's been there since we discovered antibiotics. It also exists in nature. It's also because it's part of the balance of nature. One bacteria fighting another bacteria, and they use antibiotics on each other. Their form of fight is an antibiotic, technically, and we are just partaking in that sense.
Yes.
It's a very delicate niche, but you now have some of these bacteria that are scary to treat. Can be. So we thankfully have the ingenuity that we're continuing research all the time, and it's something evidence-based medicine is that we have to get it by number. We have to try out, we have to do research. Everyone has a part to do. Everyone has a part to play, especially if you're talking about superbugs.
Okay.
Yeah.
I know you mentioned about superbugs. Can you make it more clear?
So that's a bacteria that, when you get the report for it, it's resistant against all the antibiotics that you have readily available. Usually, for sure, we would treat those in secondary or tertiary care, very specialized care. We wouldn't give them oral antibiotics, for example. They might be needing to go on an IV antibiotic for 2 or 3 different types of antibiotic at the same time.
Okay.
The big guns, stuff that you don't have particularly in tablet form or so on. And that is a particularly difficult one to deal with. It can take a long time to treat, but it's the same as a different bacteria. So you can, for example, have a Staphylococcus aureus normal bacteria that you treat with an oral antibiotic, and you can have a superbug Staphylococcus aureus version of it, right? Okay. So this is one of the common ones. Methicillin resistant Staphylococcus aureus, MRSA. And that one particularly, you can find it. It can be in the hospital, it can be in people having it, and that one is difficult to treat.
Okay.
It's even found on the skin, for example, just different presentations to it. And in that sense, you need the specialized care for this. That's a superbug. It's not easy to deal with.
So can we prevent this bacterial, antibiotic resistance? What are the measures to be taken?
So we can slow it down. We can slow it down, that's for sure. We can't undo what's, for example, done.
Okay.
Unless you're going to go find that one resistant bacteria and somehow end it to the last bacteria that is there that is resistant. Doesn't sound humanly possible. But what you can do is you can slow it down. And we can spare whatever antibiotics that we have that don't have a high resistance to them, which is a big part of why we have guidelines. So we have different guidelines for Bahrain has a guideline, WHO has a guideline, and all this in between, from a local, regional level to a global level. There's different guidelines for antibiotic use.
Follow all those guidelines.
That's evidence-based medicine. Should be aware of one of them that's working and one that is nicely written and clear and concise, and use it as a reference resource. It would be silly to think that khalas, any doctor will know all knowledge and all that there is. And if we know it today, it will be changed in a few months. So we have to be up to date in what we end up using. And thankfully, it's readily available. You can have the most updated yearly one from the WHO for free. It's as a PDF online. Just go and you will find it. It's very clear. Sure, it's a read, but when you get into it, it's not like the theory and the knowledge of it. It's very dry and clear and concise, and as it should be in management. It's a clear decision. It's a weighed decision. So what we can do to slow it down is that we weigh that decision of prescribing an antibiotic clearly. Don't prescribe it unneeded. And that I would say to the doctors, because it's in their hands. For the patient, don't go taking it without the prescription over the counter directly, because that's what sometimes we might find happening. There's different subgroups, and there should be a clear clinical assessment of them, that we decide, okay, there's something called watchful waiting. So a child who had that ear infection, and I looked at it, we can do something called watchful waiting. It's a discussion in the clinic between the doctor and the patient regarding, say, for example, the child's health. We can say for 3 days we will treat it as the viral that it's presented to be. We can give an antiviral even if that's within the time period. And we will watchfully wait. If they're getting worse within the next 3 days, or they're not improving after 3 days, start the antibiotic. Or we can say, come back to us, which we always prefer. We'll see the child again. We can also have the same outlook for adults, healthy adults. We can say, okay, well, it's an upper respiratory infection, it's an influenza, for example, but it might develop into a lower chest or lower airway infection, and then we might have to reassess, okay, that's a bacterial infection that's superimposed over a viral, also heard of, not unheard of, it can happen. In that sense, this superimposition of bacterial over viral will warrant prescription for antibiotics. So judicial prescription is needed, and correct prescription. We should know what we're dealing with, have a low threshold if it's not working, do further testing. As we said, thankfully that's available. And if we're writing a course to the patient, we should make a deal with the patient also. Take the full course. Improvement might happen after 3-4 days, but the bacteria may survive. That one may come resistant if you continuously 5 times take the same antibiotic, cut it out after 4 days instead of 7. That is 4 times that this bacteria has encountered, 4 times that it survived. It will become more resistant. Now then that same patient will come and will have to write the second line, right? This is how it progresses, person by person to the masses.
So we have to complete the course.
Complete the course. And for most side effects, when we expect them, everything we will prescribe might have side effects, and everything in nature also may have side effects, as we said. But we can give some things for the expectant symptoms of the side effects. So if someone's having a heartburn, or someone's having an upset stomach, or crampy pains, they might even present with loose motion. We can give some things for that if it's expected, and as long as it's staying within the mild, and you can live with it and you can deal with it, that's acceptable. If it's going moderate, severe, we will next time learn and we will not give, we'll give something else. If it's anaphylactic, we immediately manage. But there's some room, there's a discussion to be had with the patient, and there's some room in prescription that we can have. I would say that overall now, there's much wiser population as patients. They're well read. We can expect to explain this discussion also, and it's what happens in the clinic. So it's thankfully something that is actually achievable, that we can slow it down if we just make the right decisions about prescribing it and using it. So use doesn't become abuse.
Yeah.
Use doesn't become abuse.
Yes,
Yeah.
yes. Is this condition reversible, doctor?
For what the antibiotics are resistant to, no. But human ingenuity, we're always in the lab figuring things out, it seems. So there might be a new antibiotic that might come, for example, that the bacteria haven't seen before. A new form, an 8th family or kind or whatever. And it will, this one we have to really preserve. That's the biggest gun. That's the one that will work, but you can't just go say, okay, this will treat all antibiotic infections. And what we can also do is we can rely on the human physiology a little bit also in this fight. With antibiotics, this is all, say, a destruction tool to the biotics. What we can do is we can also prescribe pre and probiotics.
Yes.
So as we are killing the harmful bacteria and the good bacteria, we can give something that will encourage the growth of our normal bacteria, so that it comes and it populates this normal space of ours that is supposed to be its. anyways, in the first place. That comes as foods, drinks, yogurts. There's now sachets of pre and probiotics. We can usually give it, for example, 2 to 4 hours after the tablet of an antibiotic, if it's an oral tablet, and that helps. It's also been helpful for specifically as the subgroup of women who deal with urinary tract infections, for example, and then after taking the antibiotic, they develop a fungal infection. Why is that? Because you just killed off all the bacteria, which is a normal part of your existence, the niche, and what took place instead was the fungal, which is also a normal part, but it just had room. And as it will be natural, it will grow into that space. So you end up getting the cycle, antibacterial, antifungal, antibacterial, antifungal, antibacterial. So there's now, once again, thankfully, we have advancements. We have things that we can always give with the antibiotic for it to function best without harming us, with the least harm that it could be possible for us. There's enough studies, research to look into, things to try. But the baseline stays the same. Antibiotics is for bacteria. Antibacterials is for bacteria. Antivirals is for antivirals. Antifungal is for antifungal. Antihelminth is for helminths, pinworms, and so on. And we should use everything intelligently as it's supposed to, including our body.
Yes.
Including our body, one hopes. Right?
That is
Try
very
our best for
informative.
that. And when we have to use external assistance, we should use it correctly also.
Okay, doctor. Any advice from your side for our viewers on a healthy lifestyle?
Well, in that sense also, I would say the baseline has always been the same. Take care of yourself in a general aspect. Be kind to yourself. Eat well. Drink a lot of water. Do your exercise. Those 3 just mentioned are plenty enough to do a lot of proportion of good towards someone. Eating healthy, drinking a lot of water, and doing the good exercise can help with a lot of the non-communicable diseases, hypertension, blood pressure, cholesterol issues. They can just have a massive, biggest return of investment that you can make towards the body and towards yourself. As far as that goes, you can also, I would say, always seek help. It's always there if you need it. That you can go to someone, ask the question. There's always someone. Personally, if I don't have the knowledge, I may find for someone who has the knowledge. Yeah, tell them, okay, refer. That's something that we have. We have to all work together. And the purpose at the end of the day is, for example, the patient. So I will never give more information than to take care of yourself in this sense. There's health maintenance as much as there is treatment of illness. Yeah. So the health maintenance is a whole entire aspect of medicine on its own. Preventive medicine, it exists. Something before it even happens. You have to live a life in order to stave away from it, like this. So having that kind of life, I wouldn't say live scared or, no. But just be smart, judicial, and seek help when you need it. Yes. Personally, I'll be in Hilal Sitra, so feel free to do that.
Thank you, doctor. Thank you for being with us. And this is a very informative episode, and we were waiting for hearing from you about antibiotic resistance. Thank you once again.
It was great being here. Thank you for having me. And I'm glad that this is out there, and this is the season for it. This is the season for it. It happens to be the flu season. We get a lot of the fevers. We get a lot of this watchful waiting. It can be a stressful time, but take care of yourself and your loved ones. Watchful waiting can be a thing. And as long as there's the follow-ups and the close follow-up, each person gets. Come to me in 3 days, come to me in 5 days, come to me in 7 days. Cough may be there for 2 weeks. Expecting things, but as long as we are taking care of ourselves and getting the help when we need it, it should, inshallah, all be fine.
Thank you once again. So viewers, I hope this was very informative and helpful. As doctor said now, always consult your physician while using antibiotics, and always be careful about the use of antibiotics. So stay happy and healthy. This is Jasila Mujib signing off. Good night.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.